Greetings and welcome to the Southside Help Center Show. I'd like to thank everyone for tuning in, and this is a live call-in show, so if you have any questions about anything that we're going to be talking about, please give us a call here at the station. Our number here is 312-738-1060, so please give us a call if you have any questions. We're going to talk about a whole bunch of stuff today. The first thing I want to make sure that everybody remembers, we've been talking about it for months. We got the Teen Summit that will be going on this Saturday. Now, the Teen Summit is going to be phenomenal. I'll say that again. It's going to be a phenomenal program that the Southside Help Center, along with Restored Hope, is putting on. It's for teens ages 12, 13, 14, and up. It goes all the way up. We're going to be doing violence prevention among youth. We're going to be doing HIV prevention as well as STDs among youth. We're also going to be doing violence prevention, HIV prevention, and domestic violence, or either teen dating violence. We're going to be talking about all those different things. We also have signs and symptoms for parents. It's so important that the parents come out and be a part of this, because the one thing about having signs and symptoms, if you don't know what to look for in an abusive relationship, when a kid starts to using alcohol or other drugs, if you don't know what to look for as a parent, how do you begin to help? How do you start that process? So parents, come out and get as much information about signs and symptoms as possible. The other thing is we love parent involvement and participation, because you may know something that I don't know. So we want to make sure that we get as many parents out to the Youth Summit as we possibly can, because again, you are the engine who drives the car. So please, parents, come out, be a part of the Teen Summit. It's going to be, let me give you the overhead really quickly. It's going to be Saturday, March the 19th. We're going to get started at 10. Please be on time. We got a phenomenal program put together for you, so we need people to be on time. We're going to have live entertainment. We're going to have the Global Girls perform. The Global Girls is a performing arts group. Now, what the Global Girls do is they have a routine that they perform. It's going to be unbelievable. So please come out and be a part of that. That's going to start our program, and then we'll go into our workshops. We're going to have lunch. We're going to raffle off a PlayStation bundle pack. We're going to raffle off a couple of iPods. We also have a few things that we've gotten from BET and other sponsors that we're going to raffle off as well. So please come out and get this information. We're going to be at Shelton Heights Church of Christ. Shelton Heights is on 113th and Halsted. They have been phenomenal in their support of the Teen Summit. And one thing that we love is when we get communities and community residents as well as churches, because we're always talking bad about the churches and what they don't do in the community. So when we get a church who is doing wonderful things, such as Shelton Heights Church of Christ, we want to make sure that everybody knows that they are doing. Pastor Gilbert and Shelton Heights is doing a phenomenal job in motivating people to be a part of this. They've offered us or allowed us to use their space free of charge, because this is a community-oriented program. And we thank you, Pastor Gilbert. We thank you, Shelton Heights. We thank you, Barbara Collins, for all of your assistance in helping us to put together the Teen Summit. So we thank you. I don't want to continue to talk about the Teen Summit, but we're going to talk about it throughout the program. We're going to get here. My phone is ringing, and we know that's our rule, so we done put the phone away. I don't know who's calling, but we'll get back to him. The one thing we want to do is we got Mr. Charles Nelson here. Let me tell you, people, we've been trying to get Charles Nelson on the show for weeks now. And I ain't finna talk bad about him, because I got him and I appreciate having him. And we don't want to take up too much time, but we want to make sure people come out to that Teen Summit. I hate to put together these type of programs and you do not take advantage of them, and then later on you go to talking about what our kids don't have. Later on you go to talking about you didn't know, when in actuality we're trying to provide you with this information. The only way that you can get it is to come out Saturday the 19th, Shelton Heights, 113th and Halsted, and get this information. We hope to see you there. Now, we got Mr. Charles Nelson here. I ain't even finna ask him all of the questions. I want to go right. I want Charles to introduce himself. Charles Nelson is one of the program directors at the Southside Help Center. He does a number of different things. So the first thing we want to do, Charles, is kind of get you to run down a list of the things that you're actually involved with as far as programming. So let's start there.
All right. As you said, Mr. Cherry, I'm the director for the Young Men Who Have Sex with Men project at Southside Help Center. Southside Help Center has been doing this project for over 12 years now. And I've been fortunate enough to be involved with this project almost from its conception. Our project is to reach out to young men who have sex with men to help educate them around prevention, safer sex behaviors, how not to put themselves at risk also for STDs and STIs, also dealing with ways to change behaviors and having healthier, safer relationships. We also a resource for helping them to have more welcoming identity around their sexual orientation. We do testing at our office, which we're located. Our satellite office is located in the Hyde Park neighborhood at 1525 East 55th Street
Okay.
on the third floor in Suite 300-A. It's one of Southside's 3 satellites. We also do other programs where we do community outreach. We go out into the neighborhoods. We pass out safer sex kits. We also do counseling around sexual behaviors and how to change their risk behaviors.
Yeah. And make sure that write down the number to the Southside Help Center. Our number is 773-445-5445. So if you don't get an opportunity to ask the question today, you can call us back at the office, and you'll be able to talk to Mr. Nelson one-on-one, and he'll be able to give you more information. Again, Southside Help Center has been around for approximately 23, almost 25 years now, and we've been doing HIV prevention and education, and Mr. Nelson has been involved in our MSM programs for about 12 years, so he's very knowledgeable about the populations in which we serve. So if you don't get enough information today, please call us at the agency 773-445-5445. Your extension is?
My extension is 7024. I'm sorry.
What is it? Say it again.
7024.
7024. So you can always reach him directly if you don't get that much information again. So please do call us. Go ahead, Charles. I was just pausing to make sure that we
Thank you.
covered that.
One of the many things that we also do programs in the community. I'm involved with a lot of other community groups. There's an organization called the Chicago Black Gay Men Caucus, which we also reach out in the community doing activities around bringing men in our community to talk about safer sex, how to change behaviors. I sit also with many other roles that I have. I also sit on the Communities of Color Coalition, which is a organization that brings together all different organizations that also reach this target population of men who have sex with men, women who are at risk, men and women who are using drugs and might put themselves at risk also.
Okay, because you got to remember the Southside Help Center does prevention, and that's what we're talking about here. We're talking about prevention, and we do it across the board. We look at a holistic approach to prevention. And that's why we have so many different programs, and we do collaborations, and that's why you talk about the Black Gay Men Caucus and Southside Help Center, Southside Help Center Restored Hope, Southside Help Center and Howard Brown, Southside Help Center, and so many different organizations, because we want to make sure that we as effective as we possibly can in bringing HIV prevention and education. And we like to think that we're a big part of why, if our numbers don't go down, at least hopefully they can just kind of go straight across the borders, continue to rise within our community. So that's a big part of why Charles and all of those collaborations that we're part of.
Yeah, I mean, out of the years of working in this field, as you have also, Cherry, we've been out here talking about prevention, how important it is to have prevention, because of if there's no education, behaviors won't change.
Absolutely.
And Southside has been in this fight for 25 years,
Yes.
and you and I have been in this fight probably just as long. I know I've been in this fight before even Southside started, but it's fortunate enough to work at Southside and continue to work in the population that I want to serve.
I actually started back in 1989. That's a story I'll tell at another time, but that's when I actually started providing HIV education, and it was directly to my family. And now all of you have become my family, and that's why we continue to provide this prevention, HIV prevention and education, because we want to make sure that we get the word out here and make sure that people are getting it tested. One of the things Charles talked about is satellite stations. We have a number of locations at the Southside Help Center. Our bank project, which is a capacity building project that's on 95th Street, and that program speaks directly to other community-based agencies and making sure that they're able to provide services. The other thing is our 104th locations, which is our primary locations, which is where we house most of our youth programs. We also do free testing. And then we have the office that Mr. Nelson is directly involved with, which is on 55th Street, and that's our office that deals with most of our YMSM programs. So again, we have a number of different programs that we want you to become involved in. If you have any questions, this is a live call-in show. I got a professional here. If you have any questions, when we're talking about MSMs, we want you to give us a call here at the station and take advantage of Mr. Nelson's experience. He's been in this fight for over 20 years. I'm just going to cap it at 20, but he's been in the fight for more than 20 years. So if you have any questions, this is a live call-in show. Call him, ask questions. The number here is 312-738-1060, and Mr. Nelson will do his best to answer those questions. If he can't, he will get that information and he will get back to you. So please give us a call. Here at the station, this is the Southside Health Center Show. I got Mr. Charles Nelson. He's talking about our YMSM and MSM programs as well as our collaborations. Now the YMSM program, tell me about that specifically, the age group in which it serves, because we always talk about MSMs and we're talking about prevention, and he talked about behavior. And that's what we're talking about. It's not who you are, but what you do that puts you at risk. So we want to talk about behavior and what we can do to either change it, slow it down, or either something.
Yeah.
You know, and that's what it's about, trying to make some changes and adjustments to this behavior, or to our behavior.
Exactly, Mr. Cherry. We definitely know that when we look at the numbers of HIV rates, especially here in the city of Chicago, and actually across this country, the highest numbers of HIV rates are among men who have sex with men, and definitely young men, and those are young men, the ages of 13 to 24.
Why do you think that is?
I think it really is because of lack of education, also around lack of feeling comfortable around sexual orientation. There's not enough programming to help deal with stigma in the community, and because there's really not enough program targeting towards that population to make them feel like it's really targeted towards them. You know, we hear about HIV a lot of times, about put on the condoms, about safer sex. But sometimes if you're thinking that the message is for the general population, you don't read it as being for your own community. So they don't see themselves as being at risk. And also, young men, as we know, feel as though they're invincible, that nothing's going to happen to them, or that their life is going to end anytime soon anyway, because we know how young men in our community are dying from a number of things, between gang violence, and a number of other things in our community. So the ideas about how life is, living to be the age you are and I am, they don't even
mean the age I am?
Well, you're a little younger than I am, Mr. Cherry.
Okay, go ahead.
But they don't see themselves as living that long anyway.
Okay.
So they don't have any vision, because they also don't see the mature men who have sex with men in their neighborhood anyway, because we lost a lot of brothers during the fight when HIV first started.
Absolutely. Yeah, this is what I need you to do. I know you have a list of things that you wanted to cover, and I wanted to make sure that we got through those. So we're going to turn this into the Charles Nelson Show, as well as the Southside Health Center Show. And I want you to kind of go through all of the information that you wanted them to know. So it's important that they know what it is that you're here to talk about, and what it is, what services you can provide, and how they can acquire or get those services. So we're going to turn it into the Charles Nelson Show, and I want you to kind of go through some of the bullet points that you have, or some of the things that you have that you really want people to know about the YMSM project, and what it is, or what services you can provide for them.
Okay. Well, you also mentioned, Mr. Cherry, our other satellite office. We have 3 offices. The main office on 104th Street. We have a satellite office in Hyde Park, and there's another office I also work out of. I work a lot of areas. The bank project, which is building communities of colors program, that's out of the 95th Street office. And in that program, we do capacity building. We do national capacity building, where we help organizations improve their whatever way they're working with their population they are. I've been involved in capacity building. It's kind of like organizational counseling, where we work with organizations, see how they can improve the population that they want to reach. So that's another thing I do also. And my experience of working with the MSM project is a technique that I bring to the bank project.
Gotcha.
Now, out of the Hyde Park office, we have several things that we do. One of the things we do, recruitment and retention through outreach. We look for young men in that target population, 13 to 24, to bring them into our office, to bring them into what we call case management. And the case management is built around prevention. Okay.
Let me slow stop. You say that target population. So you're talking about the MSM population. That's men who have sex with men. or gay, however you want it. We don't want you to think. We want to make sure that people understand what target population you're talking about.
Exactly.
And the other thing we want to make sure that people understand is the type of services that they can actually get, because people do struggle with sexuality, and this is a very important piece that we want to make sure that people understand, and how they can get those plugs into this program. And it's amazing. But call us, and that's the thing I want you to do. Call us, because we don't want to get off this television and then people start calling, talking about, I had a question. Call if you have any questions for Mr. Nelson. I got him here. And Shauna's over here on the phone. Miss Shauna Mitchell, our phone text, she needs you to call. It's a live call-in show. Give us a call if you have any questions.
Okay. Yes, definitely with our case management. The case management project is definitely designed to deal with sexual orientation, risk behavior, and substance use, and also dealing with other needs. Because we find out that a lot of these young men are struggling not only with those issues, but they're also struggling with continuing education. They're struggling with violence, whether it's violence from their family members, violence in relationships.
Bing, make sure, I wonder when we touch that point, when we have our teen summit, we will be talking about teen dating violence, and people always think that we're just talking about male and female, but so oftentimes there's male and male violence in relationships, and teen relationships, as well as female and female. So it's important that people understand, do not alienate yourself from this program or this process. When we're talking about domestic violence, or when we're talking about teen violence in relationships, we're talking about across the board, men and women, men and men, women and women. We ain't discriminating. It ain't up to us to do any discrimination. We just want to provide information so that people can actually, if they find themselves put in that position, have some resources to get out.
Exactly. And it's very important. One thing I know here at Southside, we always make sure that whatever message we put out there is across the board.
Absolutely.
We make sure that we have staff and members of our organization there who can answer any question, no matter what the population is that we're trying to reach.
Absolutely.
Yeah.
Go ahead. No.
Okay.
This is Charles Nelson show. I'm here with you today.
Okay,
Go ahead.
And also with prevention case management, we also deal with housing, because a lot of young men may not have a place to live. They do what is called couch surfing. They live with friends. Go ahead.
Let me ask you this. Is this for HIV positive clients, or is this in general?
Oh, no. Well, this is our case management program is for men who are negative, but we do know that some of the men that we may come into contact with may not even know that they're positive.
Okay.
So we don't, it's not that we don't work with them, but our program is to reach men who are negative to help them stay negative.
Okay, gotcha.
But we do work with also men who are HIV positive. We do case management through the main office, make sure they get into medical care, services, so that if they are HIV positive, they get the best care they can get.
Right. And make sure we do a lot of programming at Southside Health Center. We do case management. We do a lot of programming for HIV positive individuals. So it's very important that people understand we don't just provide programs for HIV positive people, but we also provide programming for HIV negative people. We want you to stay that way. But we do provide housing through our case management at our 104 office. So again, we want people to understand the Southside Health Center provides programming, but the only way that you'll know what program you fit into, or how this information is best used, one is to know your status. Mr. Nelson provides HIV testing at their location. If you think for some reason you have been exposed, the only 100% way to know is to get tested. Nobody looks like they're HIV positive. Again, you have to get tested in order to know your status, and we provide free HIV testing at the 104 location. We provide free HIV testing at the 55th Street location, and you must know your status. Again, when we talk about testing and why is it so important, people think that when you come test positive, it means that you're going to die, and that's just not the case. No. It means that you have to look at that particular behavior and make some changes, because now we're talking about making sure that you stay healthy. We're talking about improving the quality of life. Most of the time it's doing what you should be doing anyway, like eating correctly, like reducing your risk in terms of number of partners that you may have, substance use, making sure that you're not further damaging your immune system. It's about creating relationships with doctors and making sure that if medication is needed, you can get medication. If you test negative, we need to look at that behavior. What's going to keep you that way? So again, if you're testing negative, we want to make sure that people get the correct information and people look at the behaviors that keeps them negative. It's so important that people understand testing across the board, be it positive or negative. It's important that everybody knows their status, because when you know, you'll do things differently. And the one thing you want to do is definitely infect other individuals. And what people fail to realize, and I say this all the time, that people who are HIV negative become more of a danger to people who are HIV positive than people who are HIV positive are to people who are HIV negative.
Exactly.
So that's why it's so important to know your status, so that you can make sure that you do the right things in terms of behavior. It's not who you are, but what you do. It's putting people at risk.
Yes. And, also, Mr. Chair, there are some new studies out that men and women who are HIV positive, who stick to their regimen, not only live longer, but also put themselves at less at risk for HIV if for some reason a condom should break.
Yes.
Because that could happen. Although condoms are 99% definitely not at risk, but if that should happen, and if you're HIV positive, you're taking your medication, your viral load is at the level it should be at, you really have very little to worry about, because the medication is making sure that if you're having unprotected sex with someone, or if your condom should break, you would not. Most likely you may not be putting yourself at risk because you're on your regimen, and it helps a lot.
And here's the other thing I want to make sure that people understand about condom use and everything else that we talk about. The only 100% way is no sex, no drugs, no problem. No sex, no drugs, no problem. Everything else is safer. And then we start talking about levels of risk. And one of the things we talked about before is that people who are HIV positive, if there's two individuals, they think that they can engage in unprotected sex because they're both positive, when in actuality that's not a good thing. Why? Because not reinfection, you can't get reinfected. Once you're infected, but co-infection. And what happens is because HIV is such a sophisticated disease, that it has a different makeup for each individual. So even though an individual is positive and they come in contact with someone else that's positive, that's a whole nother strain, because that's a particular strain for an individual. So again, the body still recognizes that as being foreign, and it'll then take its defense mechanism and have to break it in half. So even though it may have been doing well over here with the disease, now something else has been introduced, so now your body has to send half its army over there, and guess what happens? It cannot fight as efficiently as if in fact it was just dealing with one strain of HIV. So that's why we talk about that co-infection piece, and why people need to make sure that if they're HIV positive, they still use condoms, excuse me, and they still look at risks that may further compromise their immune system. And if they're on medication or dealing with regimens, that they make sure that they take their medication properly. And the one thing that we always talk about with medication is because an individual in the beginning may not need medication. His immune system may be doing just wonderful. And if he's eating right and doing all of the things that he should, it'll stay that way. But if it's necessary, that they make sure that they get the right medication, that it's not too soon, because you don't want your body to build up a resistance and that sort of thing. So maybe on one of the other shows we'll talk a little bit more about the virus and the structure, because we talked about viral load and what does that mean for an individual who may be HIV positive. That's going to be very important. So we'll definitely talk about that. We're going to have Mr. Nelson to come back again so that we can further talk about different programs we have. If you have any questions for Charles Nelson, he has a wealth of experience. Call us here at the station. The number is 312-738-1060. 312-738-1060 is right there on your screen if you need to give us a call here at the station. Continue, Mr. Nelson.
Okay. And definitely what we're talking about today is what Southside Health Center is so good at, is we're talking about prevention, education, prevention, that will help with stopping the HIV rates in our community. One of the many other things we do, we also do an intervention, a workshop for young men who have sex with men, a workshop that's called Many Men, Many Voices. It's a very great interactive intervention. And when I say intervention, that means that it's a workshop that intervenes in giving education, giving ways to make sure that this population can interact about how not to put themselves at risk.
Okay, they flashed the light on us, so that means that we're running out of time. And it seems like the time always goes so fast.
Yes, it does.
And it's got to depend on those guests. So I thank Mr. Charles Nelson for coming in and talking about the programs that we have surrounding MSMs. If you have any questions for him and you didn't get them in today, you can call us at the agency 773 445-5445, and we'll get you plugged in with Mr. Nelson. We're going to also have Mr. Nelson to come back again so we can continue to talk about HIV and STDs among MSMs. The other thing is we got Bridges Teen Summit. Is going to be March the 19th. It's going to be at Sheldon Heights Church of Christ. It's going to be on 113th and Halsted. It's going to start at 10 o'clock. If you have youth, parents, come out, be a part of the program. We'd like to thank everyone out there who supports the Southside Help Center. Until we see you again, we bid you peace.